This is the epidemic of my generation. This is my HIV, this is my Black Plague. Oklahomans are dying from this preventable and treatable disease on a daily basis.
I think Oklahoma is in a crisis they don't realize they're in. They seem to think that the opioid addiction is still something that's out in other places. It's not, it's here. Oklahoma is the epicenter. We have counties in our state with 15, 20, 25 deaths per 100,000 in our state. That's unheard of in most of the rest of the country.
It's like nothing we've ever dealt with before. The sheer numbers of people. When you look at the overall society who takes pain pills, so many of us do.
The opioid epidemic is unique among most drug epidemics in that it is not picking which social class, and it's decimating the entire society at all levels. These Oklahomans that are dying every day are our future doctors, our future lawyers, our future engineers, and our future farmers.
Pain medication, deceptive marketing that has fueled our deadly epidemic.
What happens when they take that pill is it changes the brain. Their brain chemistry is changed, and their life is forever changed.
I don't want to be like this. I don't want to be that drug addict. That little pill will cause destruction through your whole life.
The power of addiction, it's unbelievable. Mothers will steal from their own children. Fathers will let their children go hungry to feed their illness. And indeed, children will break the hearts of their parents.
In every way, it is an illness. You know, if you had more willpower, or if you were raised better, whatever, that you could exercise control over this. And I promise you, none of my patients suffer from lack of willpower.
I remember the first time I finally realized my son was an addict. It's a sick feeling. And I knew he was in trouble, and I didn't know what to do about it.
It's not a personality flaw, it's not a character flaw. This is a biological mechanism that happens. If Mother Teresa's on these medications long enough, she'll become addicted.
We all have pain, and we all would like to kill pain.
I hope you'll get a chance to watch Killing Pain. Once upon a time, there were two young men. They lived thousands of miles apart. Brandon Whitten grew up here in Oklahoma, and Brian Mendel grew up back east in New York. Both were fine young men. You can look them both up on the internet. Both had bright, happy smiles, great lives, great families, much to look forward to. And both of them died at the same age of 25. Both of them ran into a buzzsaw, a disease that is unlike any other disease. If you contract the disease of cancer or epilepsy, heart problems, whatever, they do not bear the burden of shame and guilt and the stigma that comes with the disease of addiction. And make no mistake about it, addiction is a disease like any other. It is a disease that masquerades as bad behavior, but it's not. And both these young men ended up in the same circumstance, a number of years apart and thousands of miles apart, but they're just two. Hundreds of thousands of young people have died from this disease. And what do we do about it? I got a phone call sometime in either late 2011 or early 2012 from Gary Mendel. I did not know who he was. One of the most successful businessmen in the United States. He had a lovely family. He had this wonderful son, a great career, and much to look forward to. He had the same problem I did. I don't think either one of us knew that much about this disease until our boys got it. And we tried to do everything we could to save our boys, and we were both unsuccessful. And Gary Mendel was applying the tools that he used in his business world to this problem, and he attacked it as a problem. He researched, that's how he came up with FATE, And he called me, and I'm sure he called many, many others, and he approached this problem as a business problem. And he's still a successful business person, but he's created Shatterproof. And if you haven't seen Shatterproof, please Google it, go to the website. There is no organization other than Shatterproof that is nationwide that addresses this nationwide epidemic. Gary is the first to do this, and he's the most successful person who's done it. He is relentless in his pursuit of the solution of this problem. He is determined to see that we eliminate this scourge, especially this stigma of shame associated with addiction. There are many heroes of mine in this room today, but Gary Mendel and I share a special bond. He is truly a man of heroic proportions, and I thank him so much for coming here to Oklahoma to address you folks today. Please give a warm welcome to my friend, Gary Mendel.
Reggie, thank you. As Reggie said, we share a bond, and it's a bond that most people, anyone, would not want to aspire to, but that bond has now transformed itself into a real friendship with Reggie, and I don't know for sure, but I'd like to think our two boys are up looking down on us right now. Thank you. I've been here all morning, and I just want to say I've been honored to be here and listen to Dr. Klodny and Terry speak. You heard from two professionals that I've been now doing this full time for almost 7 years, and you just heard two presentations that I really can't add a lot of statistics to. And one of the things I think I've done smart in my life is yesterday I emailed Andrew and I asked for his presentation because I didn't want to repeat everything. So once I got his slides, I pulled out a lot of stuff out of my slides. And so today I tailored my presentation toward less about the data and more about maybe the human side of it, and a lot about what we can do, what I believe we can do, what we have been doing, and what we can all do together to tackle this problem. So I'd like to begin with a story of two boys, the way Reggie started. My story's about two different boys. One is also Brian, but also it was one of Brian's friends who was not across the country like our two boys were, Reggie, but two boys who were living side by side in our neighborhood. The story takes place in 2004. It's in a small town in Connecticut where I was raising my family, and both boys were in high school. The first, Mikey, was diagnosed with cancer. As you'd expect, his parents were devastated, but also, as you'd expect, they were easily able to access the highest quality medical care that was all based on proven research. Mikey's parents told many of their friends what they were dealing with, and our entire town rallied behind Mikey and his family. Parents came to their home with cooked meals, drove carpools. The kids in our elementary school held bake sales on the weekend for Mikey and for his new charity for cancer research. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever ask for. In fact, dream of. Well, just 2 streets away, Mikey's friend Brian, my son, was also struggling with the disease. But for Brian and our family, It was just so different. We struggled in isolation. We looked for medical care for our son the way Mikey's parents did, but unlike Mikey's parents, we couldn't find treatment that was based on proven science. It just didn't exist. Unlike Mikey's parents, I didn't tell too many of our friends what we were dealing with. To be honest, I was ashamed. I didn't know what I had done wrong as a father. I felt like a failure as a father. I couldn't understand why my son wouldn't try hard enough. And our community didn't rally behind us. No one came to our home with cooked meals, no carpools. But I didn't really think about it at the time. But when I look back now, what was most striking is when Brian came home from different treatment programs. Unlike Mikey, who saw the bake sales on the weekend to raise money for his new charity, Brian just found silence. Just silence. As you know, the disease my son struggled with was addiction. A little bit more about Brian. As a young boy, he did many of the things that young boys do. In fact, when he was born, he was everything I had ever dreamt of. My little buddy, always smiling, always hugging me, always at my side. And as he grew into a young boy, he did many of the things that young boys do. One of the things he used to love to do is play with his trucks in his room for hours, or run around the backyard chasing butterflies. And as he grew into his teen years, he did many of the things that teens do. And as Terry showed on her slides, he started drinking when he was 14 or 15 and tried pot. But unlike many who try it, Brian became addicted. And over the next 8 years, he went to 8 different treatment programs. And his use escalated into harder and harder drugs. And of those 8 different treatment programs, they were all different, except for one thing. I now know that not one of them treated my son with treatment protocols that were based on science. Science that I, as a father, didn't even know existed at the time. And there was one other common element. While Mikey was in treatment, fighting off cancer, and his friend Brian was in treatment, fighting off addiction, Mikey simply had to deal with, I say simply, Mikey had to deal with, wasn't simple, Mikey had to deal with one thing, fighting a disease. Brian had to deal with 2 things, fighting off a disease and fighting off being stigmatized as the bad kid, the kid who wouldn't try hard enough, the kid who was bringing it on himself, the kid who made poor decisions, the kid who had bad willpower. That's what Brian had to deal with, in addition to fighting a disease that had changed his brain chemistry. When I think back on those years, there were times that Brian just wouldn't listen. It didn't seem like he was following logic. But there were also times when he was in treatment, he was just going at it with all the gusto, full enthusiasm. I remember one time I flew down to Florida to visit him in a treatment program. And that first morning, I woke up early at 7:30 in the morning. To be honest with you, I just wanted to watch him sleep. I hadn't seen him in months. But he surprised me. I walked into his room when he was already up. And he was there on his bed reading his treatment book. And he looked up at me with that big smile of his. Actually, I apologize. Here's Brian in high school. He looked up at me with that big smile of his. He said, "Dad, I'm getting this. I'm going to beat it." But addiction always doesn't work that way. A few years later, I was woken up in the middle of the night by my cell phone ringing. And when I picked it up, I was told that my son Brian had just died. He was 25 years old, and he hadn't used a substance in 13 months. And even more tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes, a feeling like an outcast that shows that the history on his computer showed that he woke up that morning, researched suicide notes, wrote a note of his own, lit a candle, and took his own life, alone. Next month, on this day, 1 month from today, will be 7 years. I wish I could tell you that the anguish has dulled in time, but it hasn't. It has intensified in me knowing that my son died of a disease that is preventable and we don't prevent, that is treatable and we don't treat, that is undeniable and so many in our society continually deny. And ever since that day, I've continually asked myself the same question. If both boys had a disease, why are these stories so vastly different? Because science tells us that addiction is a disease just like any other. Its causes are genetic, biological, and environmental. But so many in our society disagree. They say those with this disease have a character flaw, and they and their families are isolated, judged, stigmatized, and silenced. And those who need the help the most often don't get it. Well, two weeks after my son Brian died, my wife came into her bedroom and found me crying on the bed. I thanked her for framing the Serenity Prayer and had placing it on my nightstand, and told her the only thing that was keeping me alive was reading that first sentence over and over again. God, grant me the serenity to accept what I cannot change. My son would not be coming home. But as the weeks and months went on, as I lay there, I started to read and think about the second sentence. The courage to change the things we can. And I began to think about what could be done to help others, with the original thought of a small local charity. So fortunately, I had some flexibility. I owned my own business. I went into the office right after New Year's and asked everybody to keep running the business for a while. That I was going to do some research, build a plan, and get a small local charity going. Maybe opening up a halfway house in Connecticut and see if we can help 10 or 20 young adults a year who are struggling. But as I began to do research, I just couldn't believe what I was learning. Everything I learned led to something else. It led me to start flying around the country and meeting with the best researchers in prevention and treatment, folks like Dr. Kolodny. And I started reading research, and I just couldn't put it down 24/7. 3 months later, I drove into work one day. I said, all right, I've been learning for 3 months. What have I really learned? I took out a white piece of paper and started writing. I wrote number 1, big. I couldn't believe it, what I had learned in 3 months. My vision of addiction was wrong. If you had asked me when my son was alive how many fathers in my small town of Easton had a son who was addicted, I would have raised my hand and said, I'm it. I'm sure there's a few others, but I don't know who they are because no one talks about it. But I never, ever could have envisioned there were 20 million people in this country addicted to drugs and alcohol. That's reported. It's probably closer to 25 million. That's 1 in 10 above the age of 12. 1 in 10. That's 1/4 of American families in our country. Mother, father, son, or daughter is addicted, or more. 3rd largest cause of death behind heart and cancer. Every day, 375 Americans, Brandons, were dying. and no one was talking about it. If 375 dolphins washed ashore, I guess that's when I say on the East Coast, here in Oklahoma, I'll say 400 cattle dropped dead. But think about what would happen if 375 cattle dropped dead. It would be on the nightly news for a month. This was 375 of our sons and daughters dying every day, and no one was talking about it. And you saw some slides there on costs. $400, $500, $600 billion a year to our federal and state governments. That's big. The second thing I wrote on my piece of paper was children. Literally 8 out of 10 of those addicted today became addicted before their 18th birthday, when their brains are still developing, as you've heard, and they are not old enough to protect ourselves. And we as a society are just letting it happen. Third thing I wrote on my piece of paper was tragic. This just ripped my insides out. In that 3 months, I had become aware that our National Institutes of Health had spent over $20 billion in the last 2 decades, giving grants to researchers all over the country. And those researchers had successfully created a body of knowledge that had proven without any doubt to be able to significantly reduce the number of our teens who ever use drugs and ever become addicted. And another body of knowledge that can improve outcomes in treatment. All this information was sitting in peer-reviewed medical journals. Hardly any of it was in use. I had known nothing about this when my son was going through this. I'm reading information that could have saved my son's life, Reggie's son's life, and hundreds of thousands like them, if we had only known about it, if it had only been implemented in our communities and our healthcare system. I began to read about mothers against drunk driving, who would cut drunk driving rates in half in 2 decades. But the success of all the national organizations, of what they had done to reduce smoking. Teen smoking has gone from 25% to less than 5% today in 20 years. And here's all this information sitting there unused. Why? Number 4 on my piece of paper, I wrote stigma. Because of stigma, yes, there's a lot of research, but not near enough compared to other diseases. Because of stigma, doctors don't want to treat it. Because of stigma, policemen would want to throw people in jail. Because of stigma, young adults like my son, it turns into self-stigma, and they hate themselves. And it perpetuates even worse. And on and on. And then I asked myself how this could be. How could we have something so big? It's mostly about our children. We have information today that can start saving lives tomorrow. And it's being stigmatized and not being used. And what became right to the forefront was no national organization. American Heart Association, American Cancer Society, Susan Komen, Autism Speaks, on and on. For every major disease in this country, there was one well-funded national organization that was leading the fight to protect our families, funding private research, advocating for change, working to ensure that research that was proven to work was being implemented in our healthcare system and our communities, ending shame and stigma, and providing information and support and hope for so many. Except no such organization existed for addiction, unbelievably. I say unbelievably, but as I thought about it, probably not. Because 20 years ago, 10 years ago, you walk down this street and ask somebody to donate $1 to an organization related to addiction, they'd say, "You kidding me? Throw them in jail." Why would I donate $1? But I could see sitting at my desk in March of 2012 that this was going to start to change. It was going to move into our healthcare system over time because of the Affordable Care Act and the Parity Act, which would require health plans to cover this in parity, mental health and addiction, with other diseases. There would be some base to grow off of. This was the time to start the American Cancer Society for Addiction. Couldn't have been done 10 years earlier. So seeing this, these 5 things on a piece of paper, at that moment I happened to look up, and on the wall was the last picture of my son alive. And I had taken it 5 weeks before he died, his 1-year anniversary of being substance-free. We had been riding our bikes to dinner, chatting away, and then I looked to my right and he's gone. And I get off my bike, I turn around, and 100 yards back, Brian had stopped, and he was off his bike helping someone on the street. And I'd snapped the picture. Several months later, I hung it on my wall. It was the last picture I had of Brian alive. And now I'm looking at these 5 things on a piece of paper. Big, children, tragic, stigma, and no national organization. And I look up and I see that picture of Brian helping someone. And it just hit me. This is what I should do with the rest of my life. The next day, I came in and promoted our CFO to run my company. And I've dedicated the rest of my life to this cause. Spent the next 1.5 years building a business plan with the original researchers I met in that first 3 months and so many others like Dr. Kolodny. And as the business plan developed, so did our vision. A vision of a society that will look this disease straight in the eye, prevent it and treat it with love and with empathy, and with programs based on science, just the way we do for any other disease. Standing here today, there's no question. I miss my son every minute, and I know Reggie does too. But I also feel blessed in so many respects. Over 200,000 people have now joined with us at Shatterproof. And together, we've been very successful in making change in so many ways. Successful on a path to make our vision a reality. We've authored legislation in 15 different states, hired lobbyists, hired local PR firms, and been successful in 14 of the 15 states. And the one that missed, the governor a month later signed a declaration basically getting it through. Those laws are already saving thousands of lives each and every year. We were one of the lead advocates working with the CDC, actually put together with the CDC by Andrew, to help them against the powerful lobbying that came with that was fighting against issuing their prescribing guidelines. And those guidelines were successfully issued a few months later, because we, along with a few others, were able to battle the big pharmaceutical companies and put out the right message of why these guidelines need to be issued without being diluted and without being weakened. We've been one of many advocates getting legislation passed in 2016, and also, well, actually 2 pieces of legislation in 2016 federally, and we're very active right now in Washington. We're working around the clock on the legislation that's that's actually coming together, the Senate and the House legislation. We've worked continuously to ensure that those who need treatment for either mental health or addiction have access to this treatment, that have access to health insurance that provides this treatment with the same quality of those getting treatment paid for by insurance for any other disease. We've launched a website that's given evidence-based information to families to separate the myths, because all our information is footnoted to original research for families looking about how to prevent, treat, and recover from this disease or to help a loved one. We've launched the largest event series in in history of the United States for addiction. Our Shatterproof Rise Above Addiction Walk or Run in 11 cities this year. Events where they not only raise money for our cause, for our work, but it's also where we bring families together to support each other, to not be embarrassed about a disease they or a family member are struggling with. to come out and share and be part of a community. In the last months, I'm really happy to say that another initiative that we started a year and a half ago is now getting funded. A year and a half ago, we conceptualized the concept of changing the entire treatment system in the United States. In its simplest form, what I saw was about 35 to 40 evidence-based protocols of what treatment programs should be doing when they treat someone, all with multiple evidence-based articles written about those, randomly controlled trials. The patient does, the treatment program does ABC, the patient does better. About 35 to 40 of these. And then we had 14,000 treatment programs doing whatever they wanted. And no one had any idea which treatment programs were doing what. Fathers like Reggie and I had no idea where to send our loved one. State licensors like Terry have no idea who to license, who's doing the right things and who's not. Insurance companies have no idea who should be in network because they don't know who's doing what. The market forces were not properly being implemented to drive quality treatment like they were with other diseases. So we built a business plan to accomplish this. Step one of the business plan was take these 35 evidence-based protocols and narrow it down to less than 10. There's not a business in America that bonuses anybody on 35 things. What were the most important less than 10 things that should be in every treatment program in the United States? And then to gain consensus on these less than 10 core principles of care with the most important influencer of market forces. It's not Reggie and I. We could know what good treatment is. It's not Terry. She could know who to license and who, she could know what good treatment is to determine who she should license and who not. But if it's not being paid for properly, it's not going to be there. The most important influencer was the payers. So we brought together last September, a year ago, so a year ago, in Washington for a full-day meeting with the 6th largest health insurers in the country related to behavioral health and representatives from different government agencies. And we presented them with 8 principles of care that we had spent the last 6 months developing with the lead author of the Surgeon General report at our side and Pew Charitable Trusts. And we made a case to them. The case was you all have your own way to determine who should be in network. But it's not working very well. If you all compromise a little bit and can agree on one national standard of care, then we can fund the algorithms, the system in place to develop a scorecard of what each treatment program is providing. And then fathers like Reggie and I can know where to send our loved ones. Terry could know who to license, and the health insurers can incentivize payment in their networks for the providers who are providing the care consistent with these 8 principles of care. And driven by a nonprofit versus insurance companies would have the right perception of eliminating any conflicts of interest. So I'm pleased to say just in the last couple weeks, our budget of $5 million to build a provider rating system is now being funded, with less than half purposely from insurance companies and more than half purposely from national healthcare foundations that have completely no conflicts of interest that could be prescribed to health insurers. And we're going to begin building that next month. But the business plan has more to that. Provider national principles of care with a foundation. Number 1, provider rating system. Number 2, change payment. We have a grant and we're working on different ways to change the payment structure because it's not fair or it won't work to ask treatment programs to do ABC if they're getting paid way too much to get paid to do XYZ, which doesn't work, and not enough to do ABC. If they want to prescribe buprenorphine or Suboxone and they have to go through 3 days of prior authorizations, they're not going to do it. Or if they're not getting paid enough to prescribe it because there comes with extra time that goes along with it. They could save a lot more money if they change their payment structure and incentivize the right things and disincentivize the wrong things. So we're working on that, and we have a payer committee on that as well. We're working on a program to educate providers. So it's not just scoring them, it's helping them and educate them. We have 2 other programs in place right now in addition to our website to educate consumers. One through a channel through companies, through employees, and another one through our family program. And we're aligning all our public policies now to relate to how do we inform and treat and change the treatment system. So we've accomplished a lot. And so have you in the state of Oklahoma, as you've heard earlier. In Oklahoma, this is a listing of the legislation that's been passed in the last several years. Notably, 3 big things on there. Naloxone was passed earlier, and you have good legislation related to naloxone. Prescription drug monitoring programs is good, but not great. It could be better, and it needs to be better. And prescribing is recent. It's good, but it can be even better. 7 days is still not consistent with CDC guidelines, which recommends it most often not more than 3 days. And CDC also says many times a patient shouldn't be prescribed an opioid at all. So Oklahoma's done a lot, we've done a lot. But we all need to do better. We all can do better. Oklahoma, you've seen these statistics. But a couple of notes. As you've heard in the last couple hours, Oklahoma is doing better in relation to other states in the last couple years as far as people dying. But Oklahoma is trailing the country in many other states in a couple of key statistics. It's still behind the country in number of deaths per 100,000 people by about 10%. And it's still way behind the country in the amount of opioids being prescribed for every 1,000 people. Excuse me, for every 100 people. I guess it doesn't really matter, but way behind the country. So what can states do? I'm not going to go into the detail now. We're actually developing a document for states, a toolkit, if you will, that should be ready later, that will be ready this fall for what states can do. But I can tell you, put aside all the detail, this is intuitive and it's not complicated. It was mentioned earlier what we would do if Ebola was going across this country. The first thing you would do is contain it. That's it. Step 1. You saw the graphs on prescribing. Prescribing is the cause of the opiate epidemic. Prescribing has leveled off and is coming down. Prescribing is not near close to where it needs to be. We're still, holy cow. I don't know what that was, but I'll keep going. Is there somebody out there? Keep going? Okay. I don't know what that was. But prescribing is not even close to where it needs to be. It's still multiples of where it was versus other countries, and still multiples of where it was when we started this epidemic in 1996. 2, treat. We've talked a lot today about getting more people in treatment, but what we haven't spoken about is for every 10 people to go to treatment, less than 3 out of every 10 are even offered one of the 3 FDA-approved medications, which by far is the most important thing that's going to come out in our scorecard that's being built. If you're addicted to opioids, being offered one of the 3 and let the patient choose if that's right for them is the standard of care. And less than 3 out of 10 treatment programs even offer it. Let alone a proper diagnosis, let alone continuous care, let alone the right psychosocial interventions. Group therapy, by the way, which is in most treatment programs, has not proven to work. It's in every treatment program. It has not proven not to work, so it's not bad. But individual cognitive behavioral therapy or motivational enhancement theory, one-on-one with a therapist who's trained to deliver it, are the right interventions. And they're not paid for properly, or they're not being delivered. Rescue. Terry talked briefly about naloxone. Naloxone should be everywhere there's a fire extinguisher. In every dorm building, in every apartment building, in every fraternity house, in every apartment building, everywhere. Everywhere there's a fire extinguisher, just stick a label on it and put naloxone also here, open the glass and stick in a kit. It should be everywhere for those who relapse. Because anyone with diabetes or heart disease is going to relapse at some point, and anyone with this disease will relapse at some point. And naloxone needs to be everywhere. And by the way, contain and treat don't cost a penny. Not a single nickel. Having doctors prescribe in accordance with CDC guideline is political will. It's not a penny of outlay. Having treatment programs follow what the science shows is going to save our healthcare system billions of dollars. Naloxone will cost money. $5 to $10 billion a year to put it everywhere it needs to be. But we would give that to hurricane victims in a minute. And the last thing is stigma. We, as states, what states can do, needs to use your state resources to change the way that people think about this disease. What can employers do? This disease is costing employers billions of dollars as well, in addition to states and our federal governments. Employees with this disease cost 3 times the healthcare cost of those without the disease. Turnover is 20% higher. Lost days of work is 3 times higher. What can employers do? Understand the cost and educate their employees about this disease, just the way you were educated today. And for those companies who are interested here today, we've developed a program that was just finished 2 weeks ago to do this. It's a 90-minute self-paced program, and GE is piloting it throughout their company, and actually in 2 of their big divisions, their power and aviation divisions, this month. And it's now ready to be demonstrated to other companies who may be interested. And if it's not ours, create your own programs, but educate employees like you heard today. What can families do? Most families go to Al-Anon when they have a family member struggling. I suspect all of you have heard of Al-Anon. Al-Anon's great for the public, for the emotional support, but it does a disservice in so many ways because there's misinformation given out in those meetings, not purposely. It's the 15 or 20 people that show up, it's what they know. And there's a lot of misinformation given. So we've created, with the support of United Healthcare, a program, a 12-week program, which will be delivered in the same format of Al-Anon, support groups. And that's now being piloted in 1 city this month. We're expanding to a couple more cities next month, and it's open to be expanded into other cities and other states. And again, I'm not selling our program, it's the concept. It could be our program or anyone's program. What can each of us do? What each of us can do is what I think is the most difficult and important obstacle that we must overcome. And I mentioned it earlier. It's the way that we think about this disease, the way we talk about it, and the stigma we attach to it. We don't ask cancer patients to line up in public shaming rituals to get their chemotherapy. We go to a methadone clinic and see what people have to do to get their methadone. We don't tell someone with diabetes that the very medication that can save their lives can't be carried in an ambulance. We don't tell someone with heart disease who's had a setback that you must go to jail. We do all of these three things with those who are struggling with this disease. Stigma extinguishes the very hope and self-respect that someone battling with a difficult disease must overcome. And let me be the first to say that I get it. Those with this disease can make poor choices. And it makes it hard for us to empathize with them. I was one of them. I used to say to my son, Brian, can you try harder? I didn't understand. But I do today. I've now seen brain scans that have definitively proven without any doubt, and you've seen them today, that those with this disease, their brain chemistry has changed. Brain chemistry has changed where it makes them incapable of making a decision and following through with it, like not to take a drug, incapable of resisting urges. Incapable. The same way that someone with diabetes, their body is incapable of producing enough insulin. And I ask all of you, in the same way that drugs distort a drug user's thinking, is it possible that drugs have distorted your thinking? Are there some of you here today where you have a family member who's struggling with this disease? Are you ashamed to tell others the way that I was? How do you think that makes your loved one feel? I wish I could take time back. Are there some of you here today that say, I don't have to worry about my kids. I'm too good a family. This can all be changed. And we can change it together. I'd like to show you a short video of events we're having around the country which fosters this change in thinking. How do I play this? You're playing it? Thanks. Do I hit something?
My name is Gary Mendel. I'm the founder and CEO of Shatterproof. We are committed to ending the devastation that addiction causes families. And in just a few short years, we've accomplished so much. We've championed legislation in 14 different states, which is already saving approximately 1,000 lives each and every year. We are one of the lead advocates helping the CDC to issue their guidelines for doctors on the safer prescribing of dangerous opioids.
It's amazing here to have Wyndham Hotel Group supporting Gary and the Shatterproof organization. Shatterproof means hope to so many people, and we're so excited to be here and to be supporting this incredible organization. I think the one thing I'd want to make sure is that people understand there's nothing to be ashamed of. Addiction is a disease. It's something that we need to bring to the forefront, and we need to do away with all of the shame surrounding it and the secrecy. If we could all just come together and really talk about what this disease means and how we can address it, we'd all be better off.
I'm Demetria Polito, and I'm on the team for Newmark Night Frank. I'm here to support my mom. I lost my brother too, an overdose situation.
I'm here on behalf of my brother and my sister, both of whom I lost to substance abuse.
We are here for friends. We are here for family. We are here for community. We are here for the people on our shirts. We are here for the people on our lanyards. And we are here to bring the disease of addiction out of the darkness and into the light.
But companies and NGOs, the private, the public sector, need to come together to raise awareness, build programs, and create better awareness of all of these issues so we can all support one another.
I'm Chanel Dennis. I'm running with the team from Goldman Sachs.
And you think about the ultimate goal of curing this awful disease, please give, and give big. Thanks for being here.
If we can shift the way that we think about this disease, the way that we have with other diseases, the way we have with HIV/AIDS, the way we have with smoking, where teen smoking has gone from 25% to 5%, with drunk driving, where kids don't even think about getting into a car and drinking and driving today. Fatal accidents related to alcohol have gone down by half in the last 20 years. This can be done. And if we can do this, more people will feel loved and connected. More people will seek treatment. Fewer will die. And fewer families, like Reggie's and mine, will be shattered beyond any repair. In closing, I often think about the last time my son Brian came home for a visit, which I didn't know, certainly didn't know that it was going to be his last time home. And last day, we had a wonderful day. We played golf in the morning, beat him with a 20-foot putt. We had a family barbecue in the afternoon. And that night, after everyone went home, Brian and I were on the back porch talking about his favorite topic. And I apologize, again, from being out here in Oklahoma, but it was Giants and Eli Manning. And then the conversation turned to his recovery. He looked at me and he said, "Dad, someday, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. And Dad, I'm trying my absolute hardest." Well, the someday that Brian spoke about has not happened near fast enough. So for Brian's sake, Brandon's sake, for all those in the room here today who are in recovery, or their family members, for all those who are not in the room throughout the United States who are in recovery, for their sake, we can do this. We can drag addiction out from the shadows into our hearts. I can't imagine a more perfect expression of humanity. Thank you so very much.